Welcome to this year's Molecule of the Year award show. I'm your host, Stephanie Garza. The category of the night is Molecule Hero of the Year. Let's take a look at our nominee. The star of tonight is norepinephrine. Norepinephrine belongs to the catecholamine family, containing a catechol group bound to an amine group in addition to a methyl group attached to the amine. Before presenting the award, let's get to know norepinephrine. Norepinephrine, also known as noradrenaline, has a chemical form of C8H11NO3 and a molecular weight of 169.8 grams per mole. It takes the form of solid crystals in an off-white color. Norepinephrine has a melting point between 220 and 230 degrees Celsius and a boiling point of 442.6 degrees Celsius. It is soluble in water in the amount of 0.85 grams per liter and is also soluble in organic solvents such as dimethyl sulfoxide. Norepinephrine is stable in air but light sensitive and recommended to be stored at -20 degrees Celsius. It is also considered a food toxin and has acute oral, dermal, and inhalation toxicity. Severe overexposure of norepinephrine can cause organ failure and lead to death. Norepinephrine is combustible at high temperatures and a fire hazard in the presence of various substances. Norepinephrine's molecular shape has no symmetry. It consists of a catechol group, which is a benzene ring with 2 hydroxyl groups, an amine group, which is nitrogen containing, and a methyl group attached to the amine group. Norepinephrine's sister, or diastereomer, is isomer S-noradrenaline. Diastereomers are not mirror images and are non-superposable, meaning that their structure cannot appear identical simply by reorientation. They both have the same function in the body, but our isomer is more effective. Norepinephrine is a natural molecule found in animals. It is produced and stored in the adrenal glands located above the kidneys. Norepinephrine's function as both a stress hormone and a neurotransmitter, is released in response to low blood pressure, maintains blood pressure in times of stress, releases signals to the sympathetic nervous system in response to fight or flight, increases heart rate, and maintains normal blood glucose levels by releasing glucagon, which inhibits insulin release. If you've ever experienced a fight or flight response, stress during a time test, or butterflies in your stomach, it was because of norepinephrine. In 1945, physiologist Ulf van Euler discovered the role of norepinephrine as a neurotransmitter in the sympathetic nervous system. He found that the release of the neurotransmitter norepinephrine had direct correlation to cardiovascular activation. He shared a Nobel Prize for his work. Today, we use norepinephrine to treat low blood pressure, septic shock, and cardiopulmonary resuscitation. Norepinephrine's molecular class is the catecholamine family. Dopamine and epinephrine are also part of the catecholamine group and perform similar functions. Drawbacks of norepinephrine include an irregular heartbeat, pain, irritation, burning or discoloration at the injection site, sudden numbness, blue lips or fingernails, shortness of breath, little to no urination, and blurred vision. Signs of an allergic reaction include hives, difficulty breathing, and swelling of the lips, throat, tongue, or face. All side effects may be reported to Food and Drug Administration. Norepinephrine is synthesized from dopamine by dopamine beta hydroxylase, then released from adrenal medulla and into the blood as a hormone. Norepinephrine is distributed as the trade name brand Levofed in a sterile aqueous solution. It is then administered to a patient by intravenous infusion via a central venous catheter, followed by dilution. The solution is infused at a controlled rate using an infusion pump. The dosage distribution will vary depending on the age of the patient and the medical situation. Although its medicinal form has a few unwanted side effects, the human body relies on norepinephrine as a biological hormone and neurotransmitter to maintain blood pressure, release signals to the sympathetic nervous system, and maintain blood glucose levels. The discovery of the benefits of norepinephrine by Ulf van Euler is considered to be a huge accomplishment to the medical industry and for modern pharmaceutical technology. For these reasons, norepinephrine is Molecule Hero of the Year. Thanks for watching!